Good morning. Thank you for joining us during May Trauma Awareness Month for a special injury prevention event brought to you by UW Health and FAC-TV City of Fitchburg. Today we present traffic safety in Madison and Dane County, current and future efforts to prevent pedestrian, bicycle, and motor vehicle injuries and fatalities. We are live to you today through your local cable and streaming services. My name is Hisu Jung. I'm a trauma surgeon at the University of Wisconsin and UW Health. I'm honored by the opportunity to welcome and moderate a discussion between a group of incredible panelists who are key stakeholders to improving the safety of our neighborhoods. Our plan today is to discuss traffic safety in our Dane County local area. We'll spend the next hour discussing where we are today, where we're headed, and how we as individuals and a community can impact our health and safety. Before we get started, a reminder to our live audience joining us, you can enter questions for the panelists at any time through email at mlauby, L-A-U-B-Y, @uwhealth.org. We will be dedicating time at the end of our session to answer those questions on the air, so I hope you'll join us today in our discussion. Now, without further ado, please join me in welcoming our panelists. I'll ask each of our panelists to introduce themselves, their title, their role at their institution, and I'll ask them two questions. One, why is it important for a more seamless approach to pedestrian, bicycle, and traffic safety across Madison and Dane County? And two, what's missing for that and what needs to change for that to be possible? So first, let me introduce Lisa Bullard-Cawthorne. Lisa?
Hello, my name is Lisa Bullard-Cawthorne. I am representing Safe Communities, Madison and Dane County. My role with Safe Communities is there's a project that I'll be talking about shortly that, and I am acting as a traffic safety consultant. One of the things that I do, my duties with this project are to co-facilitate the Traffic Safety Commission, and I'll be talking about that in a little while, and in collaboration with the Dane County Sheriff's Office. And I'm there to assist with gathering community input for prioritizing issues and forming action steps. My vision for a seamless approach is that, my vision is to reduce injury and death in Madison and Dane County by reviewing the data and collaboration and participation with the community. So I think, the aspect of the seamless approach is to make sure that we're bringing together the community and getting community input and mobilizing the community to take action. What is missing is that oftentimes you have agencies that are looking at the data, but it doesn't always translate into taking action. And so one of the projects that I'll be talking about is actually looking at the data, bringing people together and taking steps through mobilization of the community and the stakeholders that are involved.
Thank you, Lisa. Next up is Renee Callaway. Renee?
Hi, so I'm Renee Callaway, and I am the City of Madison's Pedestrian and Bicycle Administrator. And obviously, my role is very importantly focused on the safety of people who are walking and biking in the City of Madison and ensuring that we can provide an environment that is safe, that feels safe, and that encourages more people to get out to walk and bike, be it for transportation or just for their overall health and well-being, which is something that we've seen so much during the pandemic. Just that need to get outside and feel like you can get some exercise for both your physical and your mental health. And I think, one of the things that we need to do is, I know where the boundaries of the City of Madison are, but we can't ignore that what happens just, a block away in another municipality still matters, and it is not seen as different. And, they're cross-jurisdictional, there's the county, the state, other municipalities. We really all need to be in this together if we're really going to address safety for all of the users on our streets, whether they're walking and biking or if they're driving. It's really a combined effort, and it also is a combined effort. It's not just traffic engineers or engineers, it's public health, it's transit, it's parks. It's really everyone working together and thinking about safety And then also trying to take that message to residents to try to also think about culture change and how we view driving, because I think that can make a difference, and that we all have to work together on this, and that we don't need to all be in our little silos, or we're never really going to make the change that needs to happen to decrease and eliminate serious and fatal crashes for everyone.
Thank you. And finally, Colleen Hosley. Colleen?
Good morning. I'm Colleen Hosley. I am a transportation planner with the Greater Madison Metropolitan Planning Organization, or MPO for short. The Greater Madison MPO leads the collaborative planning and funding of a sustainable and equitable transportation system for the Greater Madison region. The MPO is responsible for comprehensive planning and decision-making to build agreement on transportation investments that balance roadway, public transit, bicycle, pedestrian, and other transportation needs to achieve an exceptional quality of life for all in Greater Madison. And I think one of the important reasons to take a seamless integrated approach to addressing traffic safety is that safety really is everybody's responsibility. And we all need to band together to make our roadways safe for all users. And I think that one of the key things to be able to achieve that, and what we need to continue to work on, kind of echoing what the other panelists have already said, is to continue to build the safety culture where we break down barriers between different agencies, really reach out to other community organizations, private citizens, so that we're all in this together.
Thank you. If it's okay with everyone, I'll start with some data now presented from our UW Health Level 1 Trauma Center. So in 2020, motor vehicle collisions made up 25% of all admissions to our UW Health Trauma Center. 5% of injuries were due to bicycle incidents, and 1% of injuries causing admission were caused by pedestrian injuries. So that amounts to, altogether, that amounts to 1,070 admissions in 2020 for both men and women. The majority, as with most injuries, were men. But as you can see, both genders were unfortunately well represented in injuries. 874 of those admissions were due to motor vehicle injuries. And as we do with most motor vehicle injuries, we see a skew towards younger adults. Most of those injuries were caused in car collisions, but obviously moped, e-bike, scooter, ATV, motorcycle, and other truck injuries were also prevalent in our community. 152 admissions were due to bike injuries, and that's a little bit more of a flat curve throughout the age categories. And 44 pedestrian injuries caused admissions. So there were 44 admissions that were due to people walking in our community and either falling or being struck by other motor vehicles. And this is a little bit of a trend that we're showing you over time. We've slowly been seeing decreases in motor vehicle injuries, albeit still very high. In 2020, we saw a little bit of a continued decline. We thought that was a little bit attributed to the pandemic and decreased motor vehicle use for a short period of time in the spring. But the bicycle and pedestrian injuries have been staying about the same. And in the case of bicycle injuries, they've actually been going up over time to 2020, with an increase in about 20 admissions from bicycle accidents after their evaluation in the emergency department. So that's the data that we're seeing at the hospital level in terms of who we're seeing injured coming in to us and what they're presenting with. I'll now turn it over to Colleen to discuss data from Dane County.
The following slides provide background data on Dane County traffic statistics. This data is compiled by the reports a responding officer files for each reportable crash. Since 2015, 207 people have lost their lives on Dane County roadways, while 1,258 people sustained serious injuries and another 18,225 experienced minor injuries. Prior to 2020, Dane County averaged a little over 10,000 crashes per year, 32 fatalities per year, and 3,357 injuries per year. Summer months, when speeds tend to be higher, are generally the deadliest months on the road. These statistics do not include collisions with deer, which would add close to 1,000 crashes per year. Every 3 years, the Wisconsin Department of Transportation updates its Strategic Highway Safety Plan, which is a comprehensive plan that provides a synchronized framework for reducing traffic fatalities, injuries, and crashes over a 3-year period. This plan identifies critical safety concerns and outlines an action plan for federal, state, and local partners, including the private sector, community organizations, and individual citizens to follow to improve the safety of Wisconsin roadways. The current Strategic Highway Safety Plan identifies 10 priority emphasis areas for improving roadway safety, including reducing driver distraction, reduce alcohol and drug impaired driving, reduce the incidence and severity of motorcycle crashes, improve teen and older driver performance, improve safety of intersections, increase occupant protection, which includes wearing your seatbelt, curb aggressive driving and reduced speed-related crashes, reduce lane departure crashes, and improve safety culture. The next few slides will show how Dane County is doing in regards to many of these emphasis areas. So we can see here from 2015 to 2019, looking at the average, seatbelts were not worn in 36% of fatal crashes, and seatbelts were not worn in 23% of serious injury crashes. Speeding was a factor in 29% of fatal crashes and 22% of serious injury crashes. And I believe in a later presentation, we'll find out why speed is such an important factor when it comes to reducing injuries. Alcohol impaired driving was a factor in 25% of fatal crashes and 19% of serious injury crashes. Distracted driving was a factor in 12% of fatal crashes and 15% of serious injury crashes. I think an important note to provide here is we often think of distracted driving as looking at our cell phones, but distracted driving really encompasses anything that is taking our full attention away from our role of driving on the roads. When we look at non-motorized users, these are bikes and pedestrians. They were involved in 20% of the fatal crashes, as well as 20% of the serious injury crashes. Motorcycle crashes resulted in 17% of fatal crashes and 13% of serious injury crashes. And also when looking at all of the motorcycle crashes in Dane County, 76% of motorcycle crashes result in some sort of injury. Teen drivers were involved in 11% of fatal crashes and 11% of serious injury crashes. I think it's also important to note here that this does not mean that they were necessarily the at-fault driver within a crash. However, being inexperienced with the roadway, being able to react to different roadway conditions may result in greater risk for teen drivers. And when we look at older drivers were involved in 27% of fatal crashes and 16% of serious injury crashes. Finally, I mentioned what our crashes looked like prior to 2020. But as COVID had its impacts across many different areas, it also impacted traffic safety. So in 2020, there was 6,224 total crashes, which was a very considerable decrease over previous years. And you can see the chart in the bottom here, right around March, April, when the safer at home orders took place, we see a big decrease in traffic crashes. However, unfortunately, during this time, we actually saw an increase in the number of fatalities and an increase in the number of serious injuries. There were 33 fatalities in 2020 and 212 serious injuries. And from there, I will be passing it over to Renee Callaway with the City of Madison, who will talk about Vision Zero and how some of their initiatives address these different emphasis areas.
Great, thank you. And I am going to start by just talking a little bit about the City of Madison statistics, which are not that different from what you just heard about. And then before I talk more in depth about Vision Zero, I'm going to turn it over to Lisa, and then you'll come back to me. So this is just for the City of Madison, not Dane County. And this really was what inspired us to really start thinking about what you'll hear about more of Vision Zero and trying to address these serious and fatal crashes, because we saw that this, instead of what you would expect, improving, we have all kinds of new technologies, airbags, people wear seatbelts more frequently now than they did when I was a kid, just things like that that have really, you would think, made a difference. But instead, we see that they're growing, and as you saw, the 2020 statistics are not on this chart, but it definitely headed in the wrong direction this year. Even with less people overall on the road, people were driving faster, and speeds really led to these crashes being more significant. And we also are seeing that, not surprisingly, pedestrians and bicycles, they don't have airbags and all those kinds of things. And they are overrepresented considering the number of total reported crashes. They are, which is only 4%, but 27% of those are injured or killed in a crash. So that's obviously very concerning, especially as a city that very much promotes walking and biking and is well known for that. This is a trend that we don't want to see continue. We also got some data. This is for Dane County, but we're really trying to look at this with an equity lens. And what we were seeing, particularly for the motor vehicle crashes, is that there are very strong disparities in that data. And that's concerning, and that's something that we want to address in our programming. And then this map just kind of, it's a little bit hard to read, but kind of is what we call our high injury network. And this is where we're seeing these crashes that are happening that we want to do something about. And not surprisingly, they're on higher volume roads that have lots of traffic, that have higher speeds. The downtown area also, where we see a high rate of walking and biking and a lot of people trying to cross through our isthmus. And so it's not a great surprise, but this is just the data that we're using to help focus our work and really understand where we can make a difference in outcomes for people who are using any mode of travel in our city. So this is just a super quick look at some of the Madison data, which is not wildly different from Dane County. And I'm going to stop sharing. I'm going to turn it over to Lisa Bullard-Cawthorne from the Safe Communities, and then it will come back to me to talk a little bit about what we're doing here in Madison to make a difference.
Great, thanks very much. So what I was going to talk about is the Traffic Safety Commission that exists in our county. But I'm first, if you could go to the next slide, Mary. But I first wanted to just talk a little bit about Safe Communities, where, which is the organization that I represent. So Safe Communities has been around for over 20 years, and it consists of a group of about 350 organizations working together to save lives, prevent injury, and make our communities safer. So Safe Communities has always been a data-driven organization focusing on the leading causes of injury and injury-related death. The first area that Safe Communities started working on was traffic safety. And throughout the years with the leading causes of injury, they also do a lot of work with drug poisoning, falls, and suicide prevention. So the traffic safety work, you might be familiar with some of the things that Safe Communities has done over the years. One of the areas is focusing on speeding with the slow down yard signs. And the other is pedestrian safety with the pedestrian flags to help get across the road in various places, not only in Madison, but also across Dane County. So if you could move to the next slide, Mary. So what is a traffic safety commission? Traffic safety commissions have actually been in existence since the early 70s. So when there was a rapid increase of traffic crashes within the state, there was legislation that was passed that was going to require the creation of a traffic safety commission in every county. And the commissions are charged with bringing together local and state expertise to reduce injuries and death caused by traffic crashes. So what the Traffic Safety Commission does is it encourages each county to analyze their own traffic data through doing fatality reviews and looking at the fatal crashes in the past quarter, and also offering the opportunity to create traffic safety initiatives to prevent future crashes. And those initiatives, the opportunity that you have with the Traffic Safety Commission is you've got a lot of different people sitting around the table that have a role, and the hope is that you develop these collaborative initiatives. So if you could go to the next slide, please. So I just want to give you a sense of the Dane County Traffic Safety Commission, and Dane County has been really active. In fact, some of the work that's been done with the Traffic Safety Commission in Dane County has helped to broaden looking at the data from a bigger perspective. And the Traffic Safety Commission is made up of a multidisciplinary membership. Dane County has a particularly wide breadth of organizations that are involved. So there's law enforcement agencies, and they're the ones that when Colleen was talking about the data that she was sharing, and she was talking about the law enforcement agencies that do that investigation. So many of those law enforcement agencies that are involved with these crashes are very involved. Engineering, and that includes public works, traffic engineering, Dane County Highway, transportation, planning and services. So Colleen's organization is represented, as well as UW Transportation Services. Healthcare and emergency medical services are involved, public health. So for many years, I've been involved with the Traffic Safety Commission wearing the public health hat. So local public health, state public health, community organizations like Safe Communities, Safe Kids Coalition. We have people representing the justice area. There's a court commissioner, and the district attorney's office is represented. And then other organizations such as AAA, Driver's Education, and the State Lab of Hygiene. If you want to move to the next slide. So the project that I am representing, we're sort of looking at this as reimagining and expanding the Traffic Safety Commission. The goal is to try to engage the Traffic Safety Commission as leaders in a coordinated approach to traffic safety. So it's moving beyond the coalition building and problem identification. So what's happening right now is that we're developing a process and a model to try to move traffic safety stakeholders and the communities that they serve from analysis to action. Next slide, please. So what I wanted to just show you here, Colleen gave you data looking at it overall, but I wanted to just show you geographically where these crashes are occurring. So when you look at this map, this is data from traffic crashes from 2020. And if you see the red, that's where there were fatal crashes that occurred. And the orange is all the injury crashes, and they range in severity. And so I wanted to just show you that this is happening both in urban and rural areas within Dane County. Next slide, please. And so one of the big things that I've mentioned already is about the importance of getting community input. This is, as our other speakers have talked about, you know, the whole community needs to be involved, not only the agencies that are responsible for making changes such as engineering, but also to get the community very involved. So what I did here is I took that map. So what our plan is that Vision Zero is going to be getting community input within Madison itself, and Renee will be talking about that. But with this project, what we're wanting to do is do listening sessions in 13 different geographic areas outside of Madison. And this just shows you the outline of where those communities are. And I will come back to that at the end. So if you could go to the next slide, please. So what our plan is that we want to bring the community together. It's really important to get community input, not only to get what their views are and what they perceive to be the issues, but also in terms of mobilizing the community. And so the plan is that we do these listening sessions, we bring these issues back to the group, the Traffic Safety Commission, and use that information, the data from the community, the data from the crashes, to prioritize the issues. And then once we've prioritized the issues, one of the things that we want to do is expand on data-driven recommendations. So one of the things that happens at a Traffic Safety Commission meeting is once we review the data, we come up with themes of things that we're seeing. And then we're going to get other types of recommendations when we do the listening sessions. So we want to be able to expand on the recommendations that have come up to that point, and then form working groups to actually formulate collaborative action plans. And then once we've got these collaborative action plans and these work groups are set up, then the hope is that we're regularly raising awareness and implementing the things that we've talked about. And I think the other thing that is important to realize is that the work that Colleen is talking about, the work with Vision Zero, we are all partners in this together. We're building on the work that Vision Zero is doing and building on the work that the MPO is doing, and then building on the work of all of our Traffic Safety Commission members. And then the last slide. So I just wanted to bring up, you know, if there is a role that you wanted to play in all of this as part of the work that's going on with the Traffic Safety Commission, I think there's two ways of doing that. One is to consider, you know, being a member of the Traffic Safety Commission. We meet quarterly, or when we come up with prioritizing and set up work groups, if there's one on distracted driving or whatever, speeding or whatever the issues are, that this possibility of becoming a work group member. So as I mentioned, we are going to be doing these listening sessions. So if you live or work in any of these areas and are interested to be involved in terms of providing community input about those things that are affecting that specific community, then that's another way that you could be engaged, and we would love to have your input. And so if you want to go back to the last slide again, Mary, if you're interested in either becoming a member of the Traffic Safety Commission, a work group, or participating in any of these listening sessions, which are going to be taking place over the next couple of months, that's my contact information. And then I will then pass it over to Renee to talk more specifically about Vision Zero.
All right. So I want to talk a little bit specifically about this idea of Vision Zero, which is something that Madison is taking on. And it's basically a strategy to eliminate all traffic fatalities and severe injuries, while also increasing healthy, equitable mobility for everyone, no matter their mode or their ability. This started in Europe, but quickly came to the United States because European cities were seeing real success with this model. And as you can see, there are quite a few cities. These are just ones that are part of the official Vision Zero network. And Madison is kind of in the application process to become an official Vision Zero city. But there are a lot of other cities who are taking this approach without sort of going through the steps to be an official city recognized by the Vision Zero network here in the United States. So what is the difference with this Vision Zero idea? Basically, traditionally people think about traffic crashes as somewhat inevitable. It's just something that happens. And there's a lot of focus just on crashes generally. Like, we just want to stop people from crashing. And it seems very expensive to try to just make sure that no one is dying or being seriously injured. But Vision Zero kind of puts that on its head and says, no, you can prevent traffic deaths. Saving lives is not expensive. It is a very important investment. If you asked anyone whose family or was a friend of someone who was impacted by a death or a life-changing injury, they would say it would be inexpensive to make those changes. It would be better than what they're living with now. You have to factor in the fact that people are not perfect, that they will make mistakes, and you need to design the roadways in a way that accounts for those mistakes that will be made. And instead of worrying about every sort of rear end crash that occurs, but everyone is fine, no one's life is changed by it. Instead, let's change the ones that are impacting people's lives and changing them so drastically, and not worry if you have some rear end crashes, but no one is hurt. Yes, we'd love if that didn't happen. Obviously, the financial impacts of that are not equitable across groups, but no one is having to have a loved one who's not coming home or a loved one whose life is never going to be the same. So we're really trying to prevent those types of crashes, and we're really looking at the whole system. As I said, people make mistakes. How can our system account for that? And how can our system support the way that we want people to act on the roadway? And it also brings in this public health perspective. As I said, there's always been a lot of focus on just any type of crash, regardless of the outcome. And this is really more that injury-based, looking at that in the way that public health looks at preventing injuries. And instead of, as it says, why was there a crash? It's asking, why was a person so seriously injured or killed in that crash? So the Vision Zero strategies, obviously, as I talked about, collaboration across many stakeholders, people who make policies, people in public health, working with our police departments, our community members, transportation, and people in the transportation world, obviously, looking at data. This is very data driven. I know Lisa mentioned that that's very important to the work that she does, and that's very important in Vision Zero, is really understanding what's happening and why it's happening on our roads. Also, we want to prioritize equity and community engagement in our work. You're going to hear a lot on this project about speeds of travel, and we're trying to hold ourselves accountable. Right now, our goal is to eliminate serious and fatal crashes by 2030. We're developing an action plan to make that a reality, and we're asking for the funding to make that happen. And this, I just put this in because you're going to, if you live in the Madison area, you visit the Madison area, you're going to hear a lot about speed reductions. And I put this in because you probably know that a high-speed crash is going to have a very different outcome, particularly if someone's walking or biking, but it really doesn't matter. Across all types of crashes, high speeds are a factor, whereas lower speeds are really the way to reduce that serious or fatal crash. Maybe someone gets hit at 15 or 20 miles per hour, but it's going to be a very different outcome. They may never visit a UW Health facility at that, or if they do, it's going to be for a very different reason. So our next steps, we did launch this project last summer. It's kind of a crazy time to do that during the pandemic, but we really felt like we couldn't wait with seeing the number of crashes going up and the severity of the crashes that were happening. So we are continuing to look at our data. We will be launching our engagement later this month to gather more of that community input as we work on developing an action plan. It will be focused on street design changes. You'll be seeing probably more of that around the city. Definitely more lowering of speed limits. We have a number of speed reduction projects that will be happening this year and next year. Obviously, public information campaigns, we don't want to forget about the culture of driving. I think just in talking to people since we started this, I can see that there is a lot that needs to be done in that area, as people still feel like inconvenience is maybe more important than safety. And we want to change that to prioritizing safety over convenience. And then lots of education about why we're doing what we're doing. And then I just put this in. We do have a website. We are about to launch an email sort of newsletter to keep people updated on this. This is where you will be able to find information on the engagement, on projects that we're rolling out, and is a place where you can just get engaged overall, because we have a stakeholder task force. We're always welcome to new people being on that. We really want this to be a community-wide event. And also, we just in looking at our data know that the crashes that occur within the city of Madison, it's not just the city of Madison residents who are involved in those crashes. It's people from throughout, really from everywhere, but throughout the region, particularly in the county. So we really want to bring in new partnerships and think about new ways of doing this work that can really be impactful and that can make saying that we want to have zero fatal and crashes a reality, because I think it's very easy for people to think that that is an impossibility. And we want to flip that on its head and say, no, that we've seen cities, not a lot, but we've seen cities have success, and that we can be one of those cities that has that success. And that even if we don't get to zero as quickly as we want to, even one life changed for the better is important. Or if we can half that number, that is a huge impact across our community. So thank you.
All right, thank you so much for our panelists for presenting such important information about traffic safety in our area. We'll now shift to our discussion and Q&A session. All right, so let me start it off with a question for the audiences and sort of for the panelists, excuse me. And some of you guys have sort of alluded to some of the answers to these, but just to start off the discussion. Maybe I'll pose it to sort of the group. And if one of you has an answer, please speak up. So what do you guys think is the leading behavior in our community? What are the leading behaviors that really lead to serious and fatal crashes in Madison? Renee, what do you think?
Sure. So definitely, as I mentioned, speeding is one of the top reasons that we see. Also, we see, particularly when it comes to ped and bike crashes, but we do see this with motor vehicle crashes as well, the failure to yield. So really, you're just not looking for that person, not seeing each other on the street. And unfortunately, here in Wisconsin, impaired driving continues to be a serious crash factor or behavior in our crashes.
Another area that I think that we're seeing is distracted driving. Now, the data that we have actually underreports that. It's very hard to measure, and as was mentioned by Colleen before, it's not just cell phone use. It's, as you're driving around, you can see people putting on makeup or eating or doing all these different things and not paying attention to their driving. And that's another area that is of concern.
And I would also add, again, looking at seatbelt usage. Again, Wisconsin tends to have a very high rate of seatbelt usage. However, when we're reviewing these fatal and serious injury crashes, there's a big overrepresentation of people in those crashes who are not wearing a seatbelt. And when we go back and review these crashes, in many cases, the finding is, had proper restraint been used, it more than likely would have been a survivable crash.
So what can we as a community do to reduce these serious and fatal crashes. We've identified some behaviors that really contribute to them. What do you think we could do as a community?
Sure, so I'll jump in. Obviously, I think a lot of times some of these behaviors are seen too much as acceptable. So I think just that culture of not feeling like, well, as long as I'm not going more than 10 over the speed limit, it's fine. Or, well, I or the person I'm with, they haven't had that many drinks, or I don't really want to say something to someone who doesn't have a seatbelt on. But then I also think it's supporting changes in the design of streets and thinking to yourself, I mean, it's easy to say if we lower the speed limit, people are like, well, you're adding time to my daily trip, right? Like if I'm going to the office now, or I start going back to the office, but realizing that maybe a few minutes isn't really worth it, right? Like it's not a big deal, and it's more important that you're safe in your trip and that the other people sharing the street with you are safe. And I think, we're going to see more types of designs that are intended to naturally make people drive slower. And I think support for that is going to be really important as we move forward.
And expanding further on the support aspect, it's really important before an agency is going to make a change that they know that there's people that are interested to have something happen. So getting that community support, getting that community input, and then actually advocating for it, like bringing the community together, collecting information that is specific for that community, and then taking that one step further and actually contacting agencies, contacting various people that might be responsible for making the changes that you want to see that happen, and that you're willing to help support the efforts once the changes are being made, to sort of sell it to the community and make sure that people, like you can, it's one thing to put in, say, a flashing pedestrian light. But if people aren't going to use it, if people aren't going to say that, yes, we want this and yes, we will use it, then it's not going to do much good. And so it's important to get that community input and mobilize the community to advocate and then actually take action once things have changed.
And I'll also add, I think we're seeing a very needed culture shift in the way that we address safety and safety improvements. Historically, safety improvements that you'd see on the road, they would not be implemented until there was a history of either serious or fatal crashes. And we are now through Vision Zero and through other initiatives moving in a much more proactive direction, where we're trying to stop these crashes, prevent these crashes before they occur.
Great discussions, guys. So I guess I have a question maybe for Colleen. We're seeing introduction of like new technologies like autonomous cars, self-driving cars. Like, how will these new technologies impact traffic safety?
We do anticipate that the new technologies that are coming out for vehicles will have a positive impact on safety in the future. Again, if we look historically, having seatbelts introduced, having airbags introduced to vehicles have certainly led to safety improvements. While I think technology is going to help us, it's not something that we can solely count on and say we're going to have these new cars that are going to prevent crashes from happening, and therefore we're not taking as much, I would say, personal responsibility for some of those actions. But we are seeing with vehicles things like lane departure alerts, and lane departure crashes are things where you're either crossing the center line and hitting another vehicle head on, or you're leaving the road and having a rollover crash. These tend to be the serious and fatal type crashes. So as we're seeing more of these technologies with vehicles, we are optimistic that this will certainly help However, if you look, there's still a whole lot of vehicles on the road from the early 2000s or earlier than that. So it's going to take a long time before we see these technologies widely deployed on our roadways.
Thank you. Here's a question for the group. We talk a little bit about how alcohol intersects with traffic safety a lot. What do you think as panelists would be the most important things that we can do to intervene in the impact that alcohol use has in traffic safety and how we could plan around that?
You know, there's been some work that is looked at, place of last drink. And so there's an awful lot that we can do in terms of people being served and making sure, there's caring for your friends and your family in terms of discouraging people from driving if they've been drinking, but there's also that responsibility of the people that are serving people, to be making sure that people are not going to get into their vehicle, if they have been drinking. But, the other thing that I want to raise that we're finding, and I mentioned that the State Lab of Hygiene has been involved with the Traffic Safety Commission, because we are seeing an increase in drug impaired driving, and most notably marijuana. And there's been an increase in the number of crashes that have been drug involved. So it's not just alcohol, but there's other ways of being impaired. And so I think that there's that same aspect of taking personal responsibility, taking responsibility for others. And from that public health perspective, it's looking at a person that has issues with alcohol or drugs, that you're supporting efforts to help that person, not just in terms of their driving, but in terms of supporting them overall, in terms of their use disorder.
And I would jump in too, and I think this is a place where supporting more opportunities for people not to be driving when they're engaged in activities where they want to be, say, drinking, such as more transit access, more easeable, walkable neighborhoods, bikeable, things like that, that give people a real option other than feeling like the only way to go to the event that they may want to attend is by driving.
Lisa, can you delve a little bit further into the impact you said place of last drink was?
So UW, I don't know if it's still going on, but UW, I think it was through the School of Law, was collecting information that was indicating when there was a crash where they last had their drink. And they were tracking that. And this was something that came up through just informal conversations with the Traffic Safety Commission, where law enforcement agencies were assisting with that, where they were, when there was a crash, they were finding out where that person had been. And they were actually seeing patterns of people, having been at certain places. And, when we sat around the table to talk about this as a group with the Traffic Safety Commission, law enforcement, kind of know some of the places where that occurs, but it was a more, it was an opportunity to really track that and look at that and to see whether that was changing, because then it gave educational opportunities for law enforcement to go to that establishment and talk about the fact that there'd been this many crashes that had occurred and people had been drinking from their establishment. So it was going on for a couple of years, and I'm not sure if it still exists, but it was very helpful because it gave opportunities. It gave another tool for law enforcement to actually educate drinking establishments about the people that were leaving there and that were driving.
I'm going to jump in here and just add, it was going on until COVID, so I'm sure it will be resumed shortly. And it is the School of Law at the university, and the staff involved, the project folks, there were very interesting stories about them going to places, talking to the owner identifying that there was a pattern with a particular bartender who they were able to approach, and it was very effective at stopping the over-serving.
And I think that shows, like, just how you can't, these things are bigger than one sort of department or one area, that they have to be multidisciplinary to really have the impacts, because if these issues were easy to solve, we would have already done it.
That's absolutely true. I think that really focuses, though, on the need for data to be given to sort of local areas and to have local types of data available to people, because a lot of the regulations and things like that around alcohol use in the state is locally driven at the municipal level. So it's great that there's ongoing work to study that stuff. A question for Renee. Madison and Dane County is one of the best places in the world to bike and to commute. What are the types of things that we can do in terms of traffic engineering and things like that we can improve within our area to improve safety for both cyclists, pedestrians, and those interacting with those?
Sure. So first, thanks for the comment about enjoying Madison as a place to walk and bike, but we do obviously still have work to do. And I think a lot of that is in that category of how do you make sure that someone who makes a small mistake doesn't end up with a serious or fatal injury. And so I think we're really looking more at, we have this great path network that, gives a place where you don't have to worry about that interaction between motor vehicles and people walking and biking. But you can't get everywhere that you need to be. Like the path isn't where the store is, the school is, where your job is. And if you look at the streets with crashes, they might just have a painted bike lane. Well, it's very easy for someone to make a mistake, and either you need to move around an object in the street and you don't think or have time to look behind you to see what's happening, or a person in a car, as we said, distracted driving is underreported, but we all know that it is happening, that they drift over. You see it all the time. Someone kind of drifts over and that painted line isn't going to stop them. So providing more protective facilities, definitely slowing cars, people who are driving cars, slow them down so that the outcomes are not as serious. So you're going to see some speed reductions. We are doing a project that we call 20 is plenty, where we're going to start rolling out 20 miles per hour as the standard speed on some neighborhood streets, and looking to do that citywide, because we hear a lot of times about streets where people are like, well, I don't feel safe crossing that street. And it's not always a big street like Park Street or East Washington. It can be even in neighborhoods. And so we really want to look at how we can ensure that the crash never happens in the first place, or if it happens, that people are upset, but they walk away from that.
All right. Well, thank you to the panelists for a great discussion. To conclude, I'm going to ask each of the panelists to summarize their thoughts on what's possible for reducing traffic injury and fatality, what's needed to achieve that, and what we need to accomplish that, and what our public and community partners can do to help. So I'm going to ask each of you. I'm going to start with Colleen.
Thank you. I think the more opportunities we have, I think that this was a great opportunity that UW Health put on today to be able to have these larger discussions, be able to get more people involved in the discussions, definitely puts us on the right track to improve traffic safety. Again, coming at it from the standpoint that traffic safety is everybody's responsibility and we all have a role in it. We've heard today from Renee that Madison certainly has been very active with Vision Zero. The organization that I work for works with the other communities in Dane County as well. And I can say the city of Sun Prairie is currently working towards becoming a Vision Zero city, and there's other communities as well that are also interested in it. So I think that we're very grateful that City of Madison has kind of been the one to, kind of lead that initiative. But I think as as people see this, as people see the results, you're going to see that pick up in more communities around the county. And we are very excited to see that, and always willing to help communities, help different organizations that want to know crash statistics, want to know what's going on. We're happy to provide that data to them.
Thank you. Lisa?
Yes, you know, as the three of us came together and the organizations that we represent, and it just, and UW, it just reinforces that there's many stakeholders out there that have an interest in traffic safety, and there's interested stakeholders. And I think that we need to take as many opportunities that we have to be able to bring the stakeholders together, as well as getting community members involved. And if we have those opportunities where we can bring people together and look at different perspectives. And I think that, you know, we've talked about some activities that were, you know, thinking about things more broadly, looking at enforcement, engineering, education, looking at all these different aspects so that we can come up with solutions that are actually going to be more effective, and that we have opportunities where we not only make some changes, but that we continue to revisit things. You know, even if there's something that we've done, you know, if over time things change, we have to revisit those things. But we've got a lot of opportunities where we, you know, people are interested, and we have to give opportunities to bring people together so that people can step up and be involved and make the changes that need to occur.
Thank you. And then finally, Renee.
Sure. So thank you for asking. I think just being engaged in this issue, and I would just encourage people who are interested to sign up for our Vision Zero email list so they know what's happening. They see the opportunities that come along, maybe to provide input or share information. I think just getting the word out and really rethinking traffic safety overall is very important. And then I guess I would just challenge people to, you know, even just today, if you have to drive a car, or tomorrow you find yourself driving a car, just seeing how you drive and how the street impacts you, and how it feels if you're on a big wide street versus a narrow neighborhood street, and how you change your behavior. And you'll see that changes that will be proposed and are being proposed do make a difference. And just that sort of how you approach a street. So just, I think you get so used to doing an activity, if it's walking, biking, driving, that you don't pay attention to that. So I think it's an interesting challenge to take.
Well, that wraps it up. Thank you, all of us, from all of us panelists, to you joining us today at home or at work or wherever you may be. Thank you to all of the panelists today for joining us. And a special thanks to Jeremy Crosby, Scott Yarborough, and FAC TV and City of Fitchburg.